Juanita Adama, thank you for joining us on Medwatch today. Hyperbaric oxygen therapy helps patients with hard-to-heal wounds by providing oxygen-rich plasma to damaged tissue and ultimately helping them heal. After going through radiation treatment for bladder cancer, Gary Bowers suffered from radiation ulcers, a side effect that was extremely painful until he was referred to the John C. Harris Wound Healing Center.
For me, the hyperbaric treatment is an absolute godsend because nothing else worked.
After several rounds of aggressive radiation, Gary's bladder started bleeding and would not stop.
Over the last year, my bladder's been bleeding, and the doctors have tried everything they can to stop the bleeding, and nothing works. So they decided to do the hyperbaric, and it's making a big difference.
Gary said although the radiation was treating his cancer, it was not allowing his bladder to heal.
It's like if you have a sore on your arm and you keep it wet, it's not going to heal.
He was referred to the John C. Harris Wound Healing Center at Clovis Community Medical Center for hyperbaric oxygen therapy.
So we see chronic wounds. We see all kinds of chronic wounds. So chronic wounds, a wound that doesn't heal normally.
Brian Chandler is the clinical supervisor of wound care at Clovis Community and says patients who are referred to the center typically have wounds that have not healed after 30 days.
But that's not always the case, right? But anybody whose wound is not healing normally, they have a challenge healing for some reason, they end up here.
Dr. Laura Reddington says oftentimes people who undergo radiation anywhere in their pelvic area will bleed and need intervention.
That is a side effect. The bleeding gets ahead of him and it develops so fast in the bladder that his bladder is not able to drain properly.
Those who undergo hyperbaric oxygen treatment like Gary get 100% oxygen delivered to the damaged tissue, speeding up the healing process.
For radiation cystitis, often we can see improvement, but it doesn't happen after maybe 5 or 10 sessions here, and often they'll take up to 40 treatments.
Gary's condition has greatly improved since he began the hyperbaric treatment, and he is finally feeling more like himself.
Hyperbaric for me has been so easy. They slide me in the tube and I just watch TV.
Though he still has a long way to go, Gary is thankful that he is able to get his treatment close to home.
We just live 10 minutes from here, so it's so convenient to just drive here and do the treatment. I'm looking forward to me getting back to normal. You know, I'm getting stronger. I laid in the hospital bed for 6 weeks. I lost the use of my legs. Yeah, I could hardly walk. And so now I'm walking with a walker, and my legs are getting stronger, and I'm looking forward to where I can divorce that walker and get rid of the walker and walk on my own. That's what I want to do.
For more information on Community's wound care services or hyperbaric oxygen treatment, visit communitymedical.org/woundcare.